I'm Beth Siegert of Siegert and Associates, Principal Consultant. And in a nutshell, I've dedicated most of my life to working with people in addiction recovery and their families. I have decades of experience, over 3 decades of experience working on individual as well as workplace situations. And I understand that there are many, many different ways that someone can enter into recovery, not only obtaining recovery, but maintaining their recovery. Today, we're entering into our third part of our Lunch and Learn of the 3-part series. We have covered who, what, when, where, how, and why. So today we're going to be covering that final piece. I would, though, like to put a little disclaimer here at the beginning. This presentation does not reflect all of the research available. We are focusing on the highlights, and this is not intended to replace proper medical care when needed. We do hope, though, that we stimulate your motivation and interest in the recovery process. Today, in our third and final series, we're going to cover where to find help and the resources, what to do after your plan has been established or your employee's plan has been established for recovery. What is it like to have a day in the life of being at a private medical detox facility, okay? And what to expect after treatment. So we have so many options. So someone has come to you, you've worked with them, you've talked to them, they're willing to have some help. So now they're saying, okay, I want help. I need help. What are the next steps? They say they want recovery, but do they really understand what that entails? What next? What is recovery? Well, it's time for answers. Okay. Recovery is defined by SAMHSA as a process of changing through an individual's behaviors and thoughts to improve their health and wellness, to live in a self-directed lifestyle, and to strive to reach their full potential. That's a pretty good definition. Sounds pretty easy. It can take a bit of work. So our current approaches when people come and ask for help, well, typically in an employment situation, they will go ahead to their EAP, the Employee Assistance Program. Perhaps they'll be directed to a healthcare provider or sent to an emergency room for a detox if a medical intervention is required. There's counseling, there are inpatient, outpatient treatment centers, and there are numerous self-help support groups. You can find many of these listed on our website at Siegert and Associates under Resources page. However, here's our little guy with the question. Those of you who have been with us before, that this is going to be our first poll. So our first poll is, after making a decision to ask for help and becoming willing to enter into recovery, what is your next step? 1, pack a suitcase. 2, call an attorney. 3, stop abusing the substance. 4, quit your job. 5, walk your dog. Okay, so if you all would just take a moment and click the answer. Yes, we have a little humor in here today. We should probably be doing this on a Friday. We'll give everyone a chance to answer. Please participate. We'd love to have your information in there. Oh, and by the way, these are anonymous. Your names do not come up. We, as the panelists and our host, have no idea who's answering what question. So please feel free to click away. And we'll give another couple of seconds. So if we could please have the poll results. And magically, they will appear. There they are. Okay, so after making the decision, 40% of you say pack a suitcase. 80% of you hit it on the button. You need to stop using that substance. Well, where do you start? Is it safe to just go and stop using that substance? Perhaps you need to consider a safe and medically monitored manner in which to remove the substances from your body. You may not just want to do something called go cold turkey. So if we don't go into a medically assisted place, right? So here we go. The person needs to stop. Sorry, I forgot to go to my stop sign. So now we have another question for you in our chat box. So what are some of the options that you are currently aware of on how to stop using that substance? I mentioned cold turkey, but what are some of the other options that you are currently aware of in order to stop using or abusing a substance? question over here. Okay, so we have in our chat box, Coleman Addiction Medicine, yes. Matt and Mars, thank you so much. Very good programs. You'd be surprised how many people actually do put in here gold cold turkey, and we know what can happen. Maybe none of us don't know what can happen to someone who decides to just suddenly stop. Well, that can have some very serious ramifications or can be fatal. I like my little guy sitting on the question mark. He looks very comfortable. So today we're going to speak of what a day in the life of someone who chooses to go to a private medical detox facility. And I am so fortunate to have with us today Dr. Peter Coleman of the Coleman Addiction Medicine Institute. Dr. Coleman will be addressing this particular type of treatment. I, for one, believe that this is not talked of very often, and we really do need to spread the word that this is an option for people. And it does differ from being sent to your local hospital to go into a detox, and I'm sure he will address that. But let me introduce Dr. Coleman, our guest speaker. Dr. Coleman is the founder and the national medical director of the Coleman Institute for Addictive Medicine. The Coleman Institute for Addictive Medicine is a national network of outpatient addiction treatment centers and a division of Baymark Health Services. He is also the founder and owner of the Coleman Addiction Medicine in Fair Lawn, New Jersey. Dr. Coleman is board certified in both family medicine and addiction medicine. He understands firsthand the challenges our patients are facing due to his own personal struggle with the disease of addiction. He has been in long-term recovery since 1984. Dr. Coleman has dedicated his career to treating addiction patients and creating a team and an environment conducive to long-term recovery for his patients. It is my great pleasure to introduce to you Dr. Coleman.
Basically, we started doing what I called anesthesia detox there, where we put people asleep in a hospital in an intensive care unit, kept them very safe. And the idea was we would detox them and get them completely off the drugs and get them onto naltrexone. And that worked well. But then over the years, we improved it and basically found we could do it much better and much safer and much more comfortably as an outpatient procedure. And it became very successful. Patients really liked it. And that I then got asked by some people in California if we could branch out and provide the service out there. So we did. And now we have 12 clinics around the country where doctors, perform the service and use naltrexone. There's a 1-month injections become available since then called Vivitrol. And so we found that we can also use that, and insurance often covers that. And so let me just show those graphs, and I'll just sort of explain how we do the detox. So we can talk a little bit about that stuff in the future. Do we have the other slides, or are they not there? Oh, there they are. Mm-hmm. So this graph actually shows kind of what cold turkey is like. So if you look at the green line at the top, when people come in, they have a certain amount of these drugs sitting on their brain receptors, and every time they try stopping on their own and they go down this curve here, the cold turkey curve, they get just a little way down, maybe 1 day down, and they just feel so horrible that they have to use the drug again. So the red line represents what we call the ultra rapid or the anesthesia detox, where we would put them asleep. I'd have an anesthesiologist put them asleep like they're having brain surgery. And we would put a nasogastric tube down and crush up naltrexone and give it to them. And within 5 or 10 minutes, you'd see their body go through this intense withdrawal because they were going from the usual level all the way down on the red line, actually. Within 5 minutes or within 10 minutes, they'd detox completely. And the idea was they would wake up and say, wow, this is fabulous. I'm off my drugs and thank you so much. In reality, they woke up and they felt horrible because all the drugs were gone from their brain, but their brain hadn't healed yet. So the way I think of that is like a fire victim. If you take somebody whose skin is burning from a fire and you put the fire out, well, you know, they're glad about that, but their skin still feels absolutely horrible because it hasn't healed. So that's kind of what it was like. People would wake up and we'd have to keep them in the hospital for a day or so and give them lots of medicines to calm them down. So in 2002, I realized we could do a much better detox by using an outpatient procedure. So what we do now is we have patients come into the clinic and they stop at 6 o'clock the night before. And by the time they come into our clinic on day one, they're in some withdrawal, but not that bad. They've done that. I mean, everybody stops overnight and then uses again the next morning. So we just tell them don't use that morning. And so come on in, and they're feeling bad. And we keep them in the clinic for 3 or 4 hours, and we get to know them and we get their history and physical and labs and EKG and all that stuff to make sure we've already screened them. So we know they're going to be appropriate, and we give them some comfort meds. And then we give them a little dose of naltrexone that just pushes a tiny little bit of the drug out, but not so much that it pushes all of it out. And then we let them go home and we see them the next day. So you could go to the next slide. And so this is where we're giving some light sedatives on the first day. And then we give a little dose of naltrexone. Go to the next slide. And then so it's written here, microdose naltrexone. So we give this tiny little dose, and that just pushes maybe 1% of the drugs out. So it's a little uncomfortable for about an hour or two. But the trick is that it's actually tricking the brain into healing quicker, because when we give a little dose of naltrexone, it's forcing the brain to actually start making its own natural endorphins again. It's making it forcing the brain to sort of what we call down-regulate the receptors so that it's going back to normal quicker than it naturally would. And basically we do that every single day. And then on usually used to be 3 or 4 days, but with fentanyl out there, it's really difficult to detox people now. It's become more difficult. So now we do most of our detoxes over 5 days. And so we have extra days to let the heroin or the fentanyl get washed out naturally, to push a little bit out and to trick the brain into healing faster. On the last day, they come into the office for about 6 hours, and we put an IV in and we give them increasing doses of naltrexone or naloxone, actually, in order to get them to actually down to zero. And what we find is that when we do that over 5 days, it's really pretty comfortable. Patients get through it. We have a very high success rate, and we're able to get people onto that naltrexone. And so at the end of that day, we either put a naltrexone implant in them that'll last 2 months, or we give them a shot of Vivitrol, which is naltrexone in a 1-month injection, time-released, slow-release form. And that's what we do. Now, of course, that's just detox, and it's not long-term recovery. So we have now added to that what is called our 6-month recovery program. And that includes free implants for the whole 6 months, or naltrexone and the Vivitrol injections, the administration of those shots for 6 months, all the medical visits that you might need in the 6 months. And case management, we have actually a case manager who meets with the patient during the detox, develops a treatment plan, and then follows them up for 6 months to make sure they're sticking with their plan and adjusting the plan if needed. Detox by itself is not anything enough to keep people in long-term recovery. If it was that easy, we'd throw people in jail and they'd get out after a month or two and they'd say, wow, that's great, I'm never going to use drugs again. But we know that just doesn't happen. The brain is so badly affected by the drugs that it needs time to heal. And they need to learn how to deal with stress and with triggers and with memories and with emotions and all the things that lead people back to relapse.
This slide indicates what some of the costs are to the employer or the corporation. When someone is actively in one of their addictions, as Dr. Coleman had said, whatever the substance is or the behavior is, it can include also gambling, pornography, video games, technology. We discussed that in presentation 2 of 3. The bottom line is many of the results are the same. You're going to have people who are missing work. Absenteeism rates will be up. Increased healthcare costs, as Dr. Coleman had mentioned, people going through the revolving door of going into a detox, coming back, going to a rehab and coming back, but not getting a full program that is specified to them so that not only can they obtain, but they can maintain their abstinence and their sobriety. Reduce productivity, especially today during COVID when everybody's on Zoom. I mean, how many times do you turn around and you're having a meeting and all of a sudden you see, as I just did, I disappeared off the screen. You have no idea what I'm doing, how I'm behaving. Unfortunately, I did have a group that I was speaking with. Well, I can't find my cursor over there. So let's see if I can get me started again. There we go. And I could actually hear someone doing lines on their desk. And how do I know that? Well, I myself have been in recovery for over 32 years consistently. So I do know the signs, right? And also my daughter, who has my 3 granddaughters, she actually received from their school district a notification asking family members to please not smoke pot. Please don't drink at 10 or 10:30 on your Zoom meeting with your child who's in school participating. So there are many kinds of productivity issues that don't just affect your employee or your workplace, but their families and their family members and their productivity. Turnover and employee replacement. I do often go in to speak to employers and they don't have an alcohol or drug issue. They don't have anybody that has any kind of addictive behaviors. And boy, if they do, they fire them. Well, what I can say to that is, especially if you're talking at C-suite level and above, you put a lot of time and effort and money into developing that person. And I would hope that you would be willing to do the same thing to bring them around into recovery so they can continue to be one of their best employees. Because most recovering people are highly productive people. Disability and worker compensation claims. Construction workers who take a fall, somebody who has a slip and fall at work, right, sues the company. Well, were they under the influence? We don't know. That's one of the things we need to find out, and that's a cost. Lower morale and reduced employee engagement. I know for a fact when I was working in one of the corporations I worked with, we had 2 addicts on my team, and the rest of us became very weary of making up their work, taking over their commitments so that our team could be productive and produce the programs and the output we were expected to do. So not only would the addict have low morale, but the people around them who are trying to compensate and keep their jobs moving forward can become very weary and exhausted in engaging with that. Not to mention family members who are going to be calling this person in sick. You know, now you don't see them showing up on their Zoom, or they're coming in late, or they say they don't remember, or oh, they didn't get that invitation. Many things have been happening, and we're adding in the added stress of a recent election and the virus. So we really do need to have people who are very aware of people who do need help now. They may not need a severe detox, or they may have picked up drinking a lot more and now they can't come, they can't stop. So they may need a detox of one shape or another. Family members are tired, divorce rates are up. And all I can say is that there is a different way. There's a better way. There's a way to recover for the employer, the employee, and their family members. But many people just don't know where to go, what to say, or what to do. So that's why we're here. That's why we're discussing this. We're trying to get the word out to people that there are many different ways to recover. There are many ways to ask for help. But we need to be in tune when we're listening in the workplace for someone who's asking for that help. You know, they might just walk in and say, hey, boss, you know, I've been drinking, like half a gallon of vodka a day and I need some help. It may not be in your face that much, okay? We need to be trained on the nuances, on where interventions can happen sooner in order to save many years of misery for those around the person. Okay. Dr. Coleman, would you like to add anything in there? Please.
No, I mean, you covered it.
Okay.
The truth is that when patients have a job, recovery rates are a lot higher. You know, keeping your job and is a really good motivation to help people stay in recovery. So it's a win-win. There's lots of studies on airline pilots and people in the Navy and people in different, careers. And, you know, one of the reasons why, the physicians' studies have 92% success rate is because doctors like keeping their jobs. And so it's a carrot and a stick sort of thing. It's a win-win for the patient and for their family to help them stay in recovery. And it's a total win for the career and for the company to keep their employee who's already well trained, and they, as you said, they often become really productive and really just a great asset to the company. Yeah, I mean, if outpatient services, workers get back to work faster, they can return to work healthier. But as I said, it's sort of a win-win because they're not having to leave their environment, and they're still getting, I think, the right level of treatment. Especially with opioids and even with drugs like amphetamines and cocaine. With alcohol, sending somebody away for a 28-day program, always had a 60 or 70% success rate. But when we look at opioid patients, because the drugs are so powerful and the memory circuits stay active so long, the success rate for 28-day programs for opioids is very low, maybe in the 5% range. And so you can send somebody away and they do well while they're there, but they just don't do well when they come back unless they're on the long-acting naltrexone. And that's why doing the long-acting naltrexone combined with outpatient counseling is so powerful right from the start, because it helps them engage in treatment and actually change those habits.
And Dr. Coleman, the long-acting naltrexone, that does, by the end of the 6 months, it will have worn off. So the person will have very slowly weaned off of that by the time the 6 months is up. Is that correct? So they won't have a need to continue?
No, it's not quite correct, because naltrexone is a complete antagonist. It's a blocking drug. There's no withdrawal from it. You can stop it, one day and not notice any difference the next day. So the key to naltrexone therapy is keeping it going long enough until the cravings and the brain has healed. So typically what we do is we use an implant right after the detox, and that gives you 2 months. Mm-hmm. Usually then patients come for another two implants, but many people sign up for another 4 or 5 implants, so they have a whole year of implants, each one lasting 2 months, or they switch to the Vivitrol. And then when everything's going well, they're in their program, they've got their 12-step meetings, they've got a sponsor, they're in counseling, then we can switch them usually to the oral tablets, and they can sort of wean down that way, is a good way to do it.
Fantastic. And I do have some information on that slide for us. This is the Castlight health study, where Castlight analyzed nearly 1 million employer-based health insurance claims in a 4-year period. On average, 4.5% of the employees who received an opiate prescription were found to show signs of misuse. Opiate misuse among the employees is estimated to account for more than 64% of medically related absenteeism from work and 90% of disability expenses. Thank you, our chat elves. We appreciate your input. So we have another quick poll here. So this is going to be a 2-part poll. So here we go. You're going to see 2 sets of numbers. Okay, the first number represents the number of years the Coleman Institute has been open to help people. And the second number is the percentage success rate of people that completed the detox program there. So is it 10 years and 75%, 15 years and 83%, 20 years and 98%, or 25 years and 92%?
I know it.
No fair, no panelists, no hosts. And I don't think our elf should, oh, that's okay. Okay. Maybe all of our panelists have answered, and our answers come up, please. Let's see what we did on the poll. Here we go. Okay, so 20% said 15 years and 83%. 60%, 20 years and 98%, and 20%, 25 years and 92%. Dr. Coleman, would you like to answer that one?
Yeah, it's actually 22 years now. So
oh, change my slide. I'll make a note.
Oh, we started in 98. Well, we started, as I said earlier, I started doing the anesthesia detox in 98, but really it's been 20 years since we started the Coleman Institute as an entity and started doing the outpatient detox. And our 98% success rate really does not refer to long-term recovery. I wish it was that high. And of
Right.
course, we're working to get it as high as we can. But that's the percentage that we get that people actually complete the detox, which I'm very proud of. When people come to us, almost all of them actually complete the detox. It's tough. I mean, some of them fairly easy. They're not using that much, and they haven't been using for very long. And other people, it's really difficult. You know, they're using high doses. The fentanyl that's out there now is so potent, and it's so difficult to detox off, that we've had to adjust our treatment program. But you know, we're able to get 98% of them through the detox. You know, we have to, you know, adjust some meds. We have to sometimes keep them longer. We have to, you know, do some other things to get them through it. But then we are able to get them onto naltrexone, you know, at the end of the detox. So
One of the things I love about your programs is that they're very versatile and you address the individual person. What's best for them? What fits them?
yeah,
I've discussed other programs with other places, and they seem to have, this is the way we do it for everybody. And the other thing I noticed was it's highly confidential when you come into the facility. I've only been able to tour the one here due to COVID in Fairlawn, but I noticed that it is extraordinarily confidential, which I
yeah,
think is so important. You know, going into a local detox, you never know whose child is volunteering there or whose wife is a nurse there, and you may not want to be seen. Perhaps you have a position in the your local government or above that, or a very highly noted position, and you don't necessarily want people to see what you're doing and the issues you may have. And I
yeah.
do value that very highly. And I thought that that was another piece of your program that I thought was
It's a
really
beautiful
wonderful.
facility, and it's large enough that you're right. There are individual rooms that people can be in, and quite confidential. Yeah.
Wonderful. I didn't know if we had, I don't see any more questions. I think we've covered the questions that were in the chat. I did have one other thing I wanted to add in here, Dr. Coleman, unless there's something else that you would like to say.
No, then thank you for having me, and
Oh.
keep up the good work.
Oh, well, thank you. It was my pleasure. And I would love you to keep up the good work too. I think this is a message that we need to get out to everybody everywhere, just to know that this is an option. They don't have to walk into an AA room. You know, there are so many different places people can go for help. And the more that we educate counselors, medical personnel, employers, family members to know that there are different things that can help different people, because it is not one size fits all. It just isn't. I did want to add one little thing on the end, if you don't mind. Once your plan has been established, I would love people to begin considering bringing in an executive recovery coach. We're private and confidential coaching. In order to be an executive/recovery coach, you need to have been in the corporate world for at least 20 to 25 years plus in recovery for some time. And one of the things that we can help do, let's say if you've gone through the Coleman Institute, is we'll help you after you have your plan of action given to you and what you're going to be doing in order to maintain. If you have a recovery coach, we can continue to help you gather accurate information and help the client make informed decisions moving forward in their recovery, help them make decisions based on the client's values and their priorities about alcohol, drug, and other risky behaviors, and above all, to promote relapse prevention. I love what Dr. Coleman had said about once you become sober or abstinent, you don't have to relapse. It really isn't part of the program, although it does happen more often than not. And today with deadlier results than there were 35 years ago. So recovery coaches are trained to be able to see where our clients may be on that path of relapse and help them prevent that. It is a new and emerging field. We're now recognized as a specialty by the International Coaching Federation. So we combine the power of professional executive life coaching with best practices. We also, in my case, I work hand in hand with medical professionals. If my client has a psychiatrist or a psychologist or a therapist that they work with, or a sponsor they work with, because I'm not a sponsor, I'm a coach, although I have been a sponsor, put it that way. I will work with their medical personnel, and typically they use me as another set of eyes on their client or their patient to see if I might see something before the client sees it. In other words, that light at the end of the tunnel may in fact be a train, or it may not, and I can help them have another set of eyes on that light at the end of the tunnel. And I was sharing with some people the other day where I've actually gone, I do escort people. I've gone to weddings, I've gone to business conferences, I've traveled with people. I've been their aunt, I've been their sister, I've been their college roommate. It's a good thing I'm a chameleon and I know how to use it. And really, when I'm on those trips, my focus is to help that person maintain their sobriety and their abstinence. Sometimes having a person, another set of eyes, is very helpful. So there are many other tools that we can go with, a therapist and a counselor, 12-step programs, faith-based support programs, gender-specific support is out there now, online communities and podcasts, psychologists and psychiatrists. We are growing by leaps and bounds. And just before we wrap it up, I'm going to skip this one. I have a call to action slide here. If you would like to get in touch with the Coleman Institute, please take a picture of this slide. We don't mind if you do. You can give Don Hebert a call, partner with them. It takes a village. They'll host and sponsor educational events. They work with the EAPs side by side or as a standalone service. Again, please feel free to take a picture with your phone of this slide and keep it with you. You never know when you're going to need it. And then, of course, I have my little nuggets at the end too. If you're interested in hearing more about recovery coaching, I also speak at events and I work hand in hand with many people. Feel free to take a picture of this slide. And we do need to wrap up, but I would like to thank you so much, Dr. Coleman, for taking time out of your very busy day to share your wealth of experience with us and to shine some light on a very important piece of people entering recovery and maintaining their recovery. So I thank you so much for being with us. And I'm sorry, we have one chat person left here. They came at the end. Let's see.
It's just thanks, I think. Yeah.
It's a thanks. Oh, you did see it. Okay, thank you so very much. I just want to make sure it wasn't a question. So thank you so very much, Dr. Coleman, for joining me on this third piece of our webinar series. I really appreciate you for being here. And thank everyone for being with us. Please get in touch. If you have any questions, please get in touch with either one of our groups. We'd be more than happy to field questions. Okay.
Thank you.
If there aren't any more questions, thank you everybody so much. Dr. Coleman, thank you, sir.
Sure. Thank you.